The diabetic neuropathy, neuropathy, retinopathy, and nephropathy are perhaps the most feared complications of diabetes. These serious complications can lead to blindness, kidney failure, and nerve damage. In this episode, and for the next 3, I'm going to unpack these devastating aspects of diabetes. In this video, I'll explain what diabetic neuropathy is and share some tips for preventing it. If you're new to me, I'm Dr. Dwayne Wood. That's Wood with an E. The E stands for endocrinology. And on this channel, I help to educate, empower, and encourage you to take charge of your life and your health, avoid complications, and live a life fulfilling and going to the next level. This is Diabetes Awareness Month. It is November, and you've caught us in the middle of our trek through diabetes, Diabetes 101, if you will, an attempt for us to, and for me, to help the wider community educate themselves, to dispel myths, and to give some valuable information about diabetes. That's what we are doing. That's what I'm doing as we walk through this month. If you are not subscribed to our channel, you got to do it. You got to do it because we're doing some wonderful things. This is, let's see, today is the 8th, and this is the 8th episode that we are doing in this series, and we'll be doing an episode every day as we get through the month of November. Educating, empowering, and encouraging. And tonight, we're going to start talking about the triopathy. We'll talk about the other 2, retinopathy and nephropathy, over the next 2 episodes, and give some tips for all 3 of them. Okay, tonight, we're starting on this episode, we're starting with neuropathy. If you know someone that has diabetes, someone who is pre-diabetic, someone who's suffering from any complications of diabetes, go ahead and let them know that this video is here. Let them know that this series is here. They're all going to be up on the channel, and you can share them. You can go back and watch them, and we'll talk about that here in a minute as we get to the end. But let's just jump on and let's get into our subject for this episode. We're talking about neuropathy, and you'll see there on the screen that the triopathy as we call it, nephropathy, neuropathy, and retinopathy are the 3 that I described. And like I said, it's perhaps the most feared complication or feared complications of diabetes when people talk about it. Now, let me hasten to say that although we talk about the triopathy, about these things, that all the cells in our bodies, if we're diabetic, all the cells in the body are awash with high blood sugars and can have complications. These are perhaps the most complicated ones, and perhaps the ones that people hear about the most, okay? But all the other cells can also have damage. So even though we're talking about these three issues, then don't forget that there are others. We did a show on the most common signs and symptoms of diabetes. Go back and watch that, and all the others as well, okay? All right, so neuropathy. So when we talk about neuropathy, we've got to first of all talk about nerves, right? And neuropathy simply means damage to nerves. That's all that word means, damage to nerves. And when we add the phrase diabetic in front of it, we're talking about the damage to nerves from diabetes. In fact, nerves are tissues that carry signals between the brain and other parts of the body, right? So these signals tell the brain how things feel. They tell the brain how to move, right? So for instance, playing a game, playing basketball, playing any sport, right? Even walking up and down the stairs. And they also help to control different functions in the body, such as digestion and so forth, right? And so when we get damage to nerves, then we can have symptoms in any place where the nerve goes, right? We'll talk about some specific ones, but remember, any signal that where a nerve is involved can be affected by neuropathy. Neuropathy can come in many flavors, right? So we can have neuropathy, peripheral neuropathy, which is the one that we're going to talk about here tonight. But you can also have autonomic neuropathy. You can have proximal neuropathy and focal neuropathy. The most interesting one in the autonomic system is when we talk about the gastrointestinal system, and that is called gastroparesis. And that is where we have abnormal movement in the GI tract as a result of diabetic gastroparesis. Once again, we can have gastroparesis from some other things, right? So we're going to focus primarily on the peripheral. So once again, when we talk about neuropathy can be caused by lots of different things. But the primary thing we're going to talk about, and the primary thing that does cause neuropathy, is diabetes. But you'll see there that you can have neuropathy from chronic kidney disease. You can have it from vitamin deficiencies, chemotherapy, environmental toxins like heavy metals. You can have an autoimmune disease, alcohol abuse. All of those things can cause neuropathy, but the most common is diabetic neuropathy. Up to about 1/2 of people with diabetes have peripheral neuropathy. Over 30% of diabetics have autonomic neuropathy, right? When we're talking about peripheral, autonomic, and some of the others, focal, the most common focal would be carpal tunnel. So even though we're going to be talking about numbness, tingling, and burning in the hands, fingers, feet, and so forth, you can have other kinds of neuropathy which are associated with diabetes as well. And so although less than 10% of people with diabetes feel symptoms of carpal tunnel, about 25% of people with diabetes have some nerve compression in the wrist. And so sometimes you'll have people complain about, my wrist is hurting. And it takes some detective work to kind of figure that out, but that also can happen. And then peripheral neuropathy is less common than some of the others. So what really causes the damage to nerves in diabetic neuropathy? So over time, remember, we have all this blood sugar that's hanging around, right? So the sugar cannot get into the cell because insulin is either not present or it is ineffective, right? So you have sugar, you have fats such as triglycerides in the blood from diabetes, and diabetes can cause elevated triglycerides as well. You've got high blood pressure, and all these things come together to decrease the nourishment to the nerves, right? Because the vessels are being damaged because of cholesterol, or they're being damaged because of high sugar themselves. And the nerves are also supposed to be helping regulate some of this. And so without enough oxygen, without enough nutrient, then the nerve begins to have problems with functioning. And that is what's causing the diabetic neuropathy. Okay? So numbness, tingling, burning, painful hands or feet, those are the things that we see when we talk about neuropathy. But if we dig a little deeper, we'll see that we can have burning, tingling, right? Feels like pins and needles. We've got numbness, of course, pain, weakness. That's an interesting one that we don't always hear, right? But these are all symptoms of some peripheral neuropathy. Problems sensing temperature, and particularly at this time of the year, if you live in the colder climates, sometimes people will get in trouble with their neuropathy, particularly if they're using space heaters, because sometimes it's cold. They set a space heater up, their feet or hands can be pointed to the space heater, and because they're not feeling well, they don't have good sensation, they don't realize that the heater is hot enough to cause damage to the skin, and so they can have burns, right? So this time of year is particularly worrisome for some people, particularly if they're using those space heaters. It happens on both sides of your body, so it's typically symmetrical. It can cause changes in the way that you walk. It can cause changes in your balance, loss of muscle tone in your hands and feet, problems, of course, sensing movement or position. So that's a complication that sometimes people, you're not sure what's causing it, right? Because your sensation of the feet, if you think about walking, right? So using your vision to see where you are, your feet are sensing where you are on the surface, and also directing how the rest of your body moves. So if you can't sense where your feet are in space, then you're relying on your eyes. And if you happen to close your eyes, then you can get some wobbliness. There's a good medical term, right? Wobbliness. So those are things that can happen as we talk about the peripheral neuropathy, and we've got to be careful that we don't overlook some of those when we're talking about patients who are suffering from neuropathy, because it can be confused with other things. So one of the things that neuropathy can cause is it can cause deformation, right? So foot problems, you can have deformed feet, you can have blisters and sores because you aren't sensing things and you step on, for instance, we've got Legos all over our house, right? So my son has Legos all over the place. So you walk, if you don't have good sensation, you step on a Lego, you step on something, right, that breaks the skin. And if you're not careful, because once again, we have poor wound healing when it comes to diabetes, then bacteria gets in there and then we get an infection. Right? So this type of diabetes-related nerve damage can also cause changes in the shape of the foot, Charcot, changes in toes, and you'll see that there. Peripheral neuropathy can also make it more likely to lose your balance, as we talked about just a moment ago. And then chronic pain or peripheral neuropathy can also lead to grief, anxiety, and depression. Can you imagine if you are constantly in pain? Constantly feeling irritation, yeah, that can be pretty depressing. So those things also can come from peripheral neuropathy. So the question that I want to ask, and you should be asking, is how do we prevent diabetic neuropathy? How do we prevent diabetic neuropathy? And what do you think the answer is there, right? So number one, we want to manage our blood sugars. You want to manage your blood pressure. You want to manage your cholesterol, because those are all things. When we talked, we did a show in this series on treatment goals. So number one was blood sugar, A1C. Number two was blood pressure, and then cholesterol. So go back, and if you have not done so already, go ahead back and watch that particular video. You want to be physically active, because when you're physically active, that moves blood in the circulation, and that helps with neuropathy. Follow your diabetes meal plan. That is, manage your food, right? And we're going to talk about that. And all of these are going to be things that we're talking about in different episodes, right? Get help to quit smoking, because smoking can worsen neuropathy, and smoking can cause progression in neuropathy, right? Damage to nerves. Limit alcoholic drinks, and take your diabetes medications, right? So how to prevent diabetic neuropathy. How to prevent diabetic neuropathy from getting worse, right? Once again, number one, manage your blood sugar, right? Manage your blood pressure, manage your cholesterol, right? Are you starting to see a theme there? Manage your weight. That's another important one. Check your feet for problems every day. Right, particularly my men, right? So we tend to get out of the shower, we dry off, we put the socks on, and we're gone, right? My ladies that are out there, you guys tend to look at your feet, and you pamper yourselves more. But guys, we need to start taking care of our feet as well, right? Put some lotion on them. I've seen some crusty feet out there, so let's not do that. Let me give me a second here, guys. Let me look over here to make sure that we are. Yeah, there we go. Okay. All right. Just want to make sure that on my other screen that everything was going well. All right. So manage your weight, check your feet, and get a foot exam at least once a year. Get a foot exam at least once a year. If you're getting pedicures, if you're getting pedicures, right? And I'm not going to even get into the discussion of should you not. But if you're going to get a pedicure, make sure you take your own equipment, right? And preferably get it done at a podiatrist. Get your nails clipped and those types of things. Don't do it at home, okay? Don't do it at home. Well, I shouldn't say don't do it at home, but don't do it at home if you're not able to see your feet. Remember, when you're clipping your toenails, you want to clip across, right? You don't want to clip all the way down close to the skin, because you can break the skin and then you run into other problems like infections and so forth. Okay, so I send my patients, when they have diabetes, I send them to see a podiatrist. Yay! To my podiatry fellas, colleagues out there. All right. So how do we treat peripheral neuropathy? And this gets interesting, right? Because there are lots of different ways to do it. Antidepressants, anticonvulsants, and you'll see those there. There are some creams that they use, patches, lidocaine, CBD. Of course, over the counter, we've got acetaminophen and ibuprofen, which can be pretty effective. Physical therapy to improve your strength and your balance. One of the people here in town, and a shout out to, I had his wife on a couple of weeks ago, to Eddie Goodman, who is a physical therapist here in town, who does a special job with neuropathy. Okay, so it's a very good work that he does. A bed cradle, right, that keeps the sheets and blankets off your legs and feet. That is sometimes helpful, because if you've got neuropathy, anything touching you can cause problems. Anything touching the feet can cause problems. So getting a cradle that lifts the sheets and so forth off of your feet can be very beneficial. Now, this is, once again, part of the triopathy that we talk about. This is part of that retinopathy, neuropathy, and of course nephropathy. And we will talk about the other two in upcoming shows. Peripheral neuropathy, diabetic neuropathy, can be minimized. And it can, and we can decrease the progression of it if we control our blood sugars, right? So that's the main point. That's the main point there. All right, so we're gonna pause here, and I'll come back and give you some final words. But right now, it is time for our amazing question wheel, right? So let's go ahead and do that right now. All right, so amazing question wheel. You remember that this is a new feature that we've added to the show, and you'll see the questions there on the wheel. I'm going to spin the wheel, and whatever question it lands on, I am going to answer. I'm going to answer it right here, and I'm going to give you a succinct, usable piece of information. The caveat to it, and though not necessarily a caveat, sorry, just pouring out some water. The caveat to it is that I've got to answer it in 45 seconds. 45 seconds, okay? And I'm going to use that answer, and I'm going to clip it out of the show and use it as a short or a brief video that we're going to put out on our social media platform. So if you are out there and you're watching this right now, I want you to go out once I put it out, and it comes out on the 9th, right? So we started the show on the 8th. So it's going to come out on the 9th. So go out and find it. And when you find it, put in the comments, hashtag I was there, right? That you were here when we did this. So let's see. All right, so let's go ahead and let's spin that wheel and see where we go. All right, round and round and round and round. Round and round and round we go. Let's see where we're going to stop. Where are we going to stop? Where are we going to stop? All right. So what is the difference between type 1 and type 2 diabetes? What is the difference between type 1 and type 2 diabetes? All right. And so we've got, like I said, 45 seconds to answer this question. And let's see what difference between type 1 and type 2. Let me think about that for a second and get my thoughts together. And then we'll bring 45 seconds up on the screen, and then I'll answer it. So let's see. Okay. Difference type 1 and type 2 diabetes. All right, here we go. 45 seconds. The difference between type 1 and type 2 diabetes has to do with insulin. In type 1 diabetes, the pancreatic cells, the beta cells that produce insulin, have been destroyed by some infection, we believe. And so there is no insulin being produced. In type 2 diabetes, the problem is not that you don't produce insulin, but the insulin is ineffective. It's not working properly. So that's the difference between type 1 and type 2 diabetes. It's an insulin problem. All right. So I think I did it. And let's... So I get a clap there. All right. Yeah, I think I did that well, right? So I think I had maybe, I think I did it and still had maybe 10 seconds. All right, I have to go back and watch that. All right. So peripheral neuropathy, a part of the triopathy. Diabetes can be a devastating disease, and the complications from diabetes can be devastating and can cause lots of morbidity. But controlling blood sugars, controlling high blood pressure, controlling cholesterol, getting exercise, managing weight, decreasing your alcohol intake, and quitting smoking are all ways that we can use to prevent the progression, the worsening of peripheral neuropathy. So my challenge to you is, if you have diabetes, get your blood sugars under control. We did a show on the targets, right? The treatment goals, the A1C goals for diabetes. Go back and watch that. If you have family and friends that need to know this information, I challenge you to send it to them. Let them know that we're here. If you have not subscribed to the channel, I want you to go ahead and do that. And let's talk about that. So subscribing to the channel, you need to go to YouTube and create a free account, right? It's a free account. Once you sign into your account, find the button that says subscribe and hit that button. You have to find my channel. Say hit the button, and then it'll come up and there's a little bell that's associated with it, and hit the bell. What that will do is anytime I put up a new video, anytime I go live, you will get notified that there's something happening on the channel, and then you can come on over and you can hang out with us, or you can watch that video. Right? As I grow the channel, as I'm trying to become more in the space, as I'm trying to speak into the space, this will help me to let the algorithm, let YouTube, let people out there know that this is content that you think is valuable, and so I can keep doing that. The other thing I want you to do, right? You're going to subscribe. You're going to create the account, free account. You're going to subscribe. You're going to hit the bell, right? That's for you. Yay. And you're going to come on back anytime there's something that's going on the channel. You're going to come back and hang out with me. You're going to watch it. You're going to like it. You're going to comment. The other thing I want you to do is go ahead and hit the share button and send the video. If you see a video, if you're watching a video, any one of the videos, go ahead and send that to family, send it to friends. Do me a favor. Let me ask you, send it to 5 people. Let them know. Say, hey, come on over and subscribe. If you've subscribed and you know someone who is having trouble trying to subscribe, and you don't think they know how to do the subscription, how to get to YouTube, do it for them. Help them set up an account, subscribe to the channel, and help them, let them know whenever things are happening, right? So you can do that. You can be an ambassador, right, for this channel. I really appreciate that. Right. As I grow, there are new things that we want to do. There are new offerings. There are new videos. There's so many things that are going on in my head, in my mind that I want to do. And that's coming, right? I'm not going to tell you all the things, but there's so much that I want to do with the series that we're doing right now, the series that we did in August, right? I've said that some of that is going to be curated and coming for you. Keep an eye out for that, right? As we get into the end of the year, as we get into the new year. Now, the month, we're only on day number 8. This is, right, the 8th show. We've got several shows. We got the rest of the month to go. Exciting stuff. Come on back, hang out with me, learn, right? As I educate, as I empower, and as I encourage you to take charge of your health, your life, avoid complications, and go to the next level. I thank you for spending some time. If you're watching this on the replay, go ahead and type in #replay, and once again, share it with somebody. Thanks for being here. Good night. I will see you at the next episode. And find the video, right? We're going to do the short. We're going to create the short. We're going to put it out. Go ahead and find it and put in it. #I was there. #I was there. Bye-bye.